So, good afternoon. I want to first begin by thanking Ontarians for their continued vigilance in the face of this virus. Thank you for continuing to adopt the public health measures that help to reduce transmission and protect yourselves, your loved ones, and your communities from the severe outcomes of COVID-19. It is clear that we are in the sixth wave of this pandemic, driven by the BA.2 variant. In the last few weeks, we have seen an increase in the percent positivity, an upward trend in wastewater surveillance, and a rise in hospitalizations. These trends are likely to continue for the next several weeks, but there are actions that we can take to help manage the impact of this wave, such as layering the personal protective measures we have adopted so well over the last 2 years, even when they may not be legally required. These include a strong recommendation to continue wearing a well-fitted 3-layer mask or use of a medical mask in all public indoor settings. And please continue to respect the ongoing mask requirements that remain in place, including in hospitals, in other healthcare settings, long-term care homes and retirement homes, congregate settings that provide care and services to medically and socially vulnerable individuals, such as children's treatment centers, in shelters, public transit, as well as the federal requirements for returning international travelers. I also want to remind Ontarians that if you test positive for COVID-19, you should continue to wear a mask at all times for 5 days following your isolation period and avoid vulnerable people in places like hospitals and long-term care. Also for masking, household and other close contacts of a COVID positive case are reminded that they should be wearing a mask at all times and avoiding vulnerable individuals and settings for 10 days. While we will not be reinstating a broad mask mandate at this time, we should all be prepared that we may need to resume a requirement for mask wearing in indoor public spaces if a new variant of concern emerges, a threat to our healthcare system, or potentially during the winter months when COVID-19 and other respiratory viruses are likely to circulate again. Vaccination remains one of the most important tools to protect ourselves and our community against the impacts of future waves of COVID-19, and it is critical to stay up to date with your vaccination by receiving all doses recommended. As COVID-19 transmission increases, getting a booster dose if you are eligible, and especially if you are at high risk, is very important. It's your best defense against severe illness, hospitalization, and death. Booster doses save lives. If you've not booked an appointment for your booster, please do so as soon as possible to ensure you are protected against severe outcomes of COVID-19. In addition to vaccines, antivirals are another tool the province is using to manage COVID-19 and are free of cost. Antiviral treatment, including the oral antiviral Paxlovid, can help to reduce hospitalizations, protect hospital capacity, and protect patients at high risk of severe health outcomes. Individuals can access oral antiviral screening tool online at ontario.ca/antiviral screener to help determine if they are at high risk for COVID-19 and its complications and should be assessed for treatment. Individuals who are part of high-risk groups and who have COVID-19 should immediately seek testing and care by contacting their healthcare provider or visiting one of the many clinical assessment centers across Ontario. Even if you don't have symptoms, talk to your primary care provider in advance to see if the treatment is right for you in the event that you get sick, and have a plan. Healthcare providers can also determine if antiviral treatment is appropriate for patients based on individual circumstances, even if they do not belong to one of the high-risk groups. So as I've said before, the pandemic certainly is not over. We're now in the sixth wave, and the virus continues to circulate and evolve. Learning to live with COVID and the expected rise in COVID cases because of the highly transmissible BA.2 variant, it is strongly recommended for all of us to, number one, screen daily for any symptoms of COVID-19. Stay at home when you're sick, even with mild symptoms. Wear a mask, especially in indoor public settings. Maintain your vaccinations. A booster dose can save your life. Assess your risk before going out. Antivirals now determine if they are right for you and immediately seek treatment if you become ill and are at high risk for severe COVID infection. Have a response plan. If symptoms develop, know where you can get tested and how to contact your healthcare provider. And test if you have symptoms. Maintain access to RAT or know where you can get your PCR testing if you're eligible for treatment. As we learn to manage and live with COVID-19, use the tools available to us to continue, and this will continue to have a critical impact on our health and health of those living in our communities. Thank you.